Hey guys, Dr. Rob here, and I wanted to welcome you down to my health corner where today we're going to talk about how to thyroid detox. Now, before I teach you this, please take a second, and if you like the information I give you at some point during the video, please give me a thumbs up. Also, hit the subscribe button and definitely hit that notification bell so that way you can get a wonderful, friendly reminder from me every time I post one of these videos, which is normally Mondays and Thursdays. That's right, twice a week, over 100 videos a year just for you guys. So first off, this thyroid cleanse is very specifically for people with primary hypothyroidism. It is not for people who have Hashimoto's, Graves' disease, or hyperthyroidism, or any positive antibodies for any thyroid autoimmune disease. This cleanse is not for you. This cleanse is for the person that has primary hypothyroidism, meaning high TSH or low T4 or low T3, but normal antibodies. So this cleanse is for you. So how would you know symptomatically if you should thyroid cleanse? Because in truth, many thyroid cases have normal lab findings, especially if they're on thyroid medication, but they still feel like garbage. So one of the ways you can know is symptomatically. And those main thyroid symptoms that we get are fatigue, depression, loss of the outer 1/4 of the eyebrows, weakening of the nails, dry skin, carbohydrate cravings, and just the feeling of lack of motivation, problems losing weight, just not having the gumption that they would normally have for life. So if any of this is painting a picture for you, even if your thyroid levels are normal, it might be a good idea for you to do this thyroid cleanse, again, providing you don't have any positive autoimmune antibodies for thyroid disease. So why should we detox in general? And specifically, why should we cleanse the thyroid gland? Well, it's because we're exposed to a tremendous number of toxins. Now, when I say tremendous, I am not exaggerating. From the 1900s, from 1900 to now, there have been over 80,000 different chemicals introduced into our environment here in America. Now, take a guess. How many of them do you think have been tested for safety by our governmental bodies? If you answered 80,000, you would be grossly mistaken. As a matter of fact, the number is only 500. That's right. Over the last 123 years, we put 80,000 chemicals into our environment, and only 500 have been tested for safety. That means the other 79,500 have not been tested. We don't know. We don't know. Are they safe? Are they not? I don't know. Let's roll the dice. Well, that's what's happening. Now, the thing that we do know is the Environmental Working Group, they examined the fetal cord blood of newly born babies. So these are babies that are just emerging from the womb. They're looking at the fetal cord blood. They're analyzing it to see, is it possible that newborn babies that haven't even been exposed to the environment could have toxicity in their cord blood, the blood that's delivering life and nutrition to them? Is it possible that the mom, through her exposure over her 20, 30, 40 years of life, could actually give those toxins to the baby? And here's what they found out. They found 287 different toxins in the cord blood of newly born babies. That's right, 287. They include things like Teflon, yes, phthalates, horrible endocrine disruptors that will mess up your hormones. Teflon, right? These are those forever chemicals that are very hard to break down in the body. They found dioxin, an extremely poisonous toxin. They found flame retardants. The amount of toxins they found, 287 in fetal cord blood. So you're being born into a world that has a tremendous number of toxins. In addition to that, 2.5 billion pounds of toxic chemicals are released into the environment every year, according to the EPA. So do you think that might be a good reason to cleanse? Yes. And this is where a lot of those toxins are coming from. Look, if that over almost 300 toxins are in fetal cord blood, how many do you think are floating around in your body right now just because of living normal life? Probably a lot. So these toxins can be behind hypothyroidism. In particular, there's 3 toxins that are in a group, as well as one additional one, These toxins are called halogens. All right, so to flash you back to high school chemistry, sorry about that, we have this periodic chart of the elements. And each one of these columns in the periodic chart, the elements in those columns, they're related to each other. They're like, cousins, they're brothers, they're aunts, they're uncles, right? So they're similar to each other, which is why they're placed in the same column. So the halogens are a group that contain things like chlorine, fluorine, bromine, and iodine. And what's needed by the thyroid? Iodine. What's not needed by the thyroid? Chlorine, fluorine, and bromine. Unfortunately, these chemicals can, from the environment in many different sources, get into the body. And what do they do to the thyroid? Well, if the thyroid likes iodine, guess what? The thyroid also has an affinity for chlorine, fluorine, and bromine. So where do we get bromine? Well, bromine, unfortunately, back in the 1970s was added into our bakery goods. You've probably seen on a label at some point, brominated flour. Why they do these things, I don't know, but they do it. So Grandma DeBeast never used brominated flour, but apparently some baker thinks they need to. Craziness. Genetically, some people were able to remove this brominated flour, which our flour today, many of it is still brominated. So check your labels. So the people who genetically can't easily get rid of bromine, the bromine accumulates in the thyroid gland. Now, when this bromine accumulates in the thyroid gland, guess what it does? It blocks the absorption of iodine, meaning if the thyroid starts to get filled with bromine, you can't fit any more iodine in there. If you can't get any more iodine in the thyroid gland, then the thyroid can't make thyroid hormone, because you make thyroid hormone essentially by taking iodine and smushing it together with an amino acid called tyrosine. You smush these guys together and you make thyroid hormone. The problem is, if your thyroid gland is filled with bromine or chlorine, which we get from chlorinated swimming pools, from chlorine bleach, from our tap water, from cleaning products, so on and so forth, or from fluorine, fluorinated toothpaste, and many other places. If your thyroid is filled with any of those chemicals, in part, it's going to reduce the amount of iodine that can get into the thyroid. If you reduce the amount of iodine that can get into the thyroid, you then can't make your thyroid hormone. If you can't make your thyroid hormone, you're now diagnosed as, you guessed it, hypothyroidism. You have hypothyroidism, but do you really? I mean, I've had patients personally in the past where they came to me with this condition. We've detoxed the chemical. We got them on the right nutrients. Their body healed their thyroid gland. Their doctor took them off their medication. They had no more hypothyroidism. So can your body do that? I don't know, because I don't know your specific case. But this is a good place to start, is doing a good quality thyroid cleanse. Now, the other toxin that can interfere with the absorption of iodine into the thyroid gland is mercury. And where do we get mercury from? Well, we get it from specific seafood like sushi, specifically tuna. You could also find it in swordfish and other very large fish that swim in the sea. The smaller fish usually have lower amounts of mercury. For example, tuna, certain forms of tuna can have over 1,000% more mercury than sockeye salmon. Okay, so let's cover the step-by-step instructions on how to cleanse some of these toxins like fluorine, chlorine, and bromine from the thyroid gland. Okay, guys, so here's how to do an 8-week detox for primary hypothyroidism. So first thing you need to know is this cleanse is in steps. So you're kind of like stepping up and then stepping down. It's a graduated approach. So what you're going to be utilizing is a few different supplements. So you're going to need to get these. You'll need the following: iodine, kelp, bladderwrack, selenium, zinc, molybdenum, and Celtic sea salt, specifically Celtic sea salt. Celtic sea salt, depending upon the source you look at, has somewhere between 32 and possibly over 90 different trace minerals. The things we do know is when Celtic sea salt is used properly in this particular cleanse, it's a really great aid for the detoxification of bromine, chlorine, fluorine, and even a little bit of mercury. Okay, so here's where you're going to start. Day one, first thing in the morning, right after breakfast, you're going to go ahead and take 225 micrograms of potassium iodide. You're then going to take 600 milligrams of kelp. You're going to take 100 milligrams of bladderwrack, the whole plant extract, 40 micrograms of selenium, 1.5 milligrams of zinc, specifically as zinc amino acid chelate, 30 micrograms of molybdenum, and then 1 teaspoon of Celtic sea salt. I'll tell you how to use the Celtic sea salt in a second. But the molybdenum is very important. The reason why is adding the zinc into your diet is actually going to kick out some copper because we don't want the copper floating around because it can be potentially toxic. So when you increase your zinc, you always want to increase your molybdenum because that's going to help pull the copper out of your body that can negatively affect you when your zinc levels are naturally increasing. Okay, so the iodine, bladderwhack, and kelp, that's literally going to help to push the chlorine, fluorine, and bromine right out of the thyroid gland. Then the selenium and the zinc are going to help with the conversion of your thyroid hormone. It's going to actually help to convert your inactive T4 to your active T3. And the Celtic salt, you're going to do 1 teaspoon in 64 ounces of water, and you're going to have that throughout the day. You're going to do this every single day for 2 weeks. And then you're going to double your dose on weeks 3 and 4. And then on weeks 5 and 6, you're going to double your dose again. And then on weeks 7 and 8, you're actually going to go back to your original dosage. Now, the Celtic salt stays at 1 teaspoon per day. You don't double that as you double the rest of the supplements. That stays consistent. Now, on this protocol, you should actually have close to a gallon of water per day because a lot of these toxins, chlorine, fluorine, and bromine, they're going to be eliminated through your urine. Some are going to come out through the stool, but a lot are going to be eliminated through the urine, so you want to make sure you're doing that. Some contraindications, again, if you have any autoimmune thyroid disease, do not do this cleanse. Increasing your iodine like this in such a format could definitely and will aggravate Graves' disease and hyperthyroidism and could potentially worsen the attack on the thyroid seen in Hashimoto's cases. So in those cases, don't do it. Not good. Now, try this out. I would love to hear back from you guys to see how you do with it, to see what type of positive effects you have. Also, keep an eye on your thyroid medication. If you're taking medication, work closely with your doctor because sometimes what happens is as this stuff starts kicking out of your thyroid gland, your thyroid starts making its own thyroid hormone, which means you need less thyroid medication or sometimes no thyroid medication. And in this video, I am in no way telling you to stop your thyroid medication or any other medication. This is purely educational information that you should take to your medical doctor and utilize if you see and he or she sees fit. So if you're doing this protocol and you notice you're starting to feel like you have hyperthyroid symptoms like anxiety, insomnia, your palms are sweaty, your heart is racy, it feels like it skips a beat, your stomach is unsettled, maybe you're losing weight. Okay, these are signs of hyperthyroidism. Does it mean you have hyperthyroidism? No, it probably means now you're taking too much thyroid medication, which is great. So your doctor and you can make that decision, and then you guys can lower your thyroid medication. And then you'll feel more normal. But then as your thyroid gets healthier again and it starts making more of its thyroid hormone, guess what happens? Well, what happens is you start to get those hyperthyroid symptoms again. You go back to your doctor, he checks your labs, and then he goes, oh my Lord, we need to drop your medication again. And eventually, hopefully you could come off your medication, or at least even reducing it is a better burden for your body. The more hormone your thyroid can make on its own, the better it is for your body, that's for sure. If you guys like this video today, please give me a thumbs up. Hit the subscribe button so you come hang out with me. Hit the notification bell so you can get this information the 2 times every week that I lay it out there. And I appreciate you guys. I appreciate your time. And look, if you want more information about how to be healthy or maybe even about how to get a healthier thyroid, check out this video right here.